Managing chronic metabolic conditions like diabetes, high blood fat hyperlipidemia, and fatty liver disease can feel daunting. Many people assume medication is the only solution. While drugs are important in acute situations, long-term reliance can cause unintended effects, including liver and kidney strain and nutrient deficiencies such as vitamin B12. This video introduces a unique method to manage these conditions naturally, through diet and lifestyle, reducing the need for prolonged medication use. The approach is based on the idea that these conditions are primarily nutritional. Diabetes and high blood fat largely result from dietary and lifestyle habits, rather than being solely genetic or inevitable. By treating the body as a system that can be cleaned and restored through proper nutrition, it's possible to stabilize blood sugar, improve fat metabolism, and support liver health. Understanding the core concept: think of your body like a room cluttered with old furniture, trash, and accumulated items. Just as cleaning a room requires a step-by-step process, managing diabetes, high blood fat, and fatty liver requires systematically clearing out excess sugar and stored fat. Then, adopting healthier habits to prevent future buildup. This process involves two essential steps. Step 1. Burn off stored energy. First step targets stored energy, especially visceral fat, the fat surrounding internal organs. Unlike subcutaneous fat under the skin, visceral fat is metabolically active and linked to insulin resistance, inflammation, and metabolic disorders. It often accumulates over years due to poor diet, excess sugar, and inactivity. Burning this fat involves creating a caloric deficit while optimizing metabolism, not extreme dieting. Key strategies include timing meals, balancing macronutrients, and adding physical activity that promotes fat burning. Step 2. Adjust daily energy intake and stored fat is mobilized. The next step is changing how daily energy is consumed. This prevents new fat buildup and blood sugar spikes. It focuses on helping the body process carbs, protein, and fats efficiently while keeping insulin levels stable. This requires thoughtful meal composition, portion control, and timing. Together, these steps naturally regulate blood sugar, reduce liver fat, improve cholesterol and triglyceride levels, and support overall metabolic health. Step-by-step guide to managing diabetes through diet. 1. Clearing out sugar and visceral fat. First step involves a structured routine to reduce excess sugar and stored fat. The main components include meal frequency, timing, and exercise. Meal frequency for optimal results. Limit eating to 2 to 3 meals per day. Snacking between meals should be strictly avoided. Continuous snacking triggers repeated insulin spikes, which prevent the body from accessing stored fat for energy. By eating only at designated meal times, the body is allowed to burn stored fat during fasting intervals. Meal timing and intermittent fasting. Spacing meals appropriately is essential. Aim for a 4-hour interval between meals. Additionally, practicing intermittent fasting for approximately 14 to 16 hours from the evening until the following morning allows the body to clear excess glucose from the bloodstream and mobilize visceral fat. For instance, finishing dinner by 7 p.m. and eating breakfast at 9 a.m. the next day creates a 14-hour fasting window. This period of fasting promotes the natural detoxification of the liver, reduces inflammation, and enhances insulin sensitivity. Exercise to support fat and sugar burning. Physical activity is a crucial complement to dietary adjustments. The video emphasizes two strategies: exercising before breakfast, engaging in light to moderate exercise on an empty stomach, encourages the body to use stored fat as fuel. Walking after meals, a 15-minute walk following the main meals of the day, can significantly improve glucose utilization and prevent post-meal blood sugar spikes. This activity is gentle enough to be sustainable for most individuals, while offering measurable metabolic benefits. By integrating these routines, the body becomes more efficient at burning fat and regulating blood sugar naturally. 2. Structuring meals for energy control and stored sugar and fat are mobilized. Careful structuring of meals ensures that new energy intake does not lead to further accumulation. Breakfast, the low-carb, high-protein approach. Breakfast should minimize carbohydrate intake while emphasizing vegetables and protein. Examples of breakfast options include chia seeds mixed with unsweetened nut milk, and a small amount of berry scrambled or boiled eggs sautéed with olive oil and leafy greens. Grilled chicken breast with a side of steamed vegetables chias to provide adequate protein and healthy fats to stabilize blood sugar and maintain satiety without triggering insulin spikes. Lunch and dinner, controlled carbohydrates and balanced nutrition for lunch and dinner. Carbohydrate intake should be limited to approximately 1 cup of rice per meal. Brown rice or cooled rice is preferred, as these options have a lower glycemic index compared to white rice. Each meal should include a generous portion of green vegetables, providing fiber, vitamins, and mineral-adequate protein from sources such as lean meat, fish, eggs, or tofu. Healthy fats, particularly from olive oil or avocado, which support cardiovascular and metabolic health. Recommend eating order. Sequence of consumption matters. Start with vegetables to slow the absorption of carbohydrates, followed by protein to provide satiety and metabolic support, and finally consume the limited amount of carbohydrates. This strategy prevents sudden spikes in blood glucose levels and promotes more stable insulin responses. Snacks and their timing. Snacks should be limited and only consumed approximately 15 minutes after a main meal if needed. Avoid continuous snacking between meals, as repeated insulin release hinders fat mobilization and increases the risk of insulin resistance. Recommended foods for snacks and between meals. When choosing snacks, select foods that are low in sugar and provide nutritional value, such as low-sugar fruits like berries, kiwi, or green apple. Sliced nuts, including almonds, walnuts, or cashews in moderation. Plain yogurt, preferably unsweetened nut. Milks, such as almond or cashew milk. These options offer satiety, support gut health, and contribute to stable blood sugar levels. 3. The science behind the approach. This method is grounded in well-established metabolic principles. Visceral fat is closely linked to insulin resistance, a primary factor in type 2 diabetes. Excess sugar intake contributes to both fat accumulation and metabolic stress on the liver. By systematically reducing sugar and stored fat while improving diet quality, insulin sensitivity improves, allowing the liver to function more efficiently. As a result, blood sugar levels stabilize. Fatty liver disease risk decreases. Cardiovascular health improves. Energy levels increase due to more efficient metabolic processes. The combination of intermittent fasting, strategic meal timing, balanced macronutrient intake, and moderate exercise creates a synergy that naturally regulates the body's energy balance and reduces the reliance on medication. 4. Practical meal example. Low-carb breakfast option. Chia seed pudding. Combine 3 tablespoons of chia seeds with 1 cup of unsweetened almond milk, a few fresh berries, and a sprinkle of cinnamon. Vegetable omelet. 2 to 3 eggs cooked with spinach, bell peppers, and a teaspoon of olive oil. Chicken and veggie plate. 4 ounces of grilled chicken breast served with steamed broccoli and zucchini. Lunch and dinner options. Brown rice bowl. 1 cup of cooked brown rice with 4 ounces of salmon, sautéed kale, and a teaspoon of olive oil. Tofu stir fry. 1 cup of cooled rice with 4 ounces of tofu. Assorted vegetables like bell peppers and mushrooms, and 1 teaspoon of sesame or olive oil. Lean meat salad. Mixed greens topped with 4 ounces of lean beef or chicken, cherry tomatoes, cucumbers, and a dressing made from olive oil and lemon juice. Snack options. A small handful 1 ounce of mixed nuts. 1/2 cup of plain yogurt with a few slices of low-sugar fruit. A cup of unsweetened almond milk with cinnamon. These practical examples demonstrate how meals can be both satisfying and effective in controlling blood sugar and fat accumulation. 5. Lifestyle integration. To ensure lasting benefits, the method encourages integrating these practices into everyday life. Key points include maintaining meal timing and fasting windows even on weekends, choosing whole, unprocessed foods over packaged or high-sugar options, engaging in at least 15 to 30 minutes of moderate exercise daily, either before meals or after, tracking blood sugar and body measurements periodically to monitor progress, avoiding the mindset of temporary dieting and instead viewing this as a sustainable lifestyle approach. 6. conclusion be following this two-step approach: first reducing excess sugar and visceral fat, then adjusting energy intake through smart meal planning. People can improve their metabolic health without heavy reliance on medication. This method targets the root causes of diabetes, high blood fat, and fatty liver, supporting liver function, stabilizing blood sugar, lowering insulin resistance, and enhancing overall well-being. Although the video offers further consultation and promotes a supportive tea, the strategies themselves work effectively without any supplements. Consistently applying these habits allows individuals to take control of their health naturally, safely, and sustainably.